Hello, I'm Kristen Coverly, ABMP's Director of Professional Education, and welcome to Lymph Talk, a series of conversations I'm having with practitioners who specialize in the manual lymphatic drainage, or MLD modality. These conversations are in conjunction with the free online ABMP CE Summit on Lymph on Tuesday, October 25th, 2022. And my hope is that they increase awareness of MLD and demonstrate how effective it can be with different populations. I'm talking today with Megan Belanger, an MLD specialist who provides oncology massage, lymphedema and lipedema care, scar rehabilitation, and occupational therapy. She's an educator and mentor in oncology massage and MLD, and teaches the lymphedema portion of our ABMP CE Summit course on the lymphatic system. Welcome, Megan. I'm so happy you're joining us for a lymph talk so we can geek out on lymph a little bit.
Thank you, Kristen. I'm super excited to nerd out about this. This is one of my favorite things to talk about. So
perfect.
Yeah, let's do it.
I love it. So let's start at the very beginning. How did you first learn about manual lymphatic drainage as a modality? How did that enter your awareness?
I was taking Tracy Welton's oncology massage course right after I finished massage school. And it was probably day 3 of the course. And one of Tracy's teaching assistants was a massage therapist and a certified lymphedema therapist. And she got up in front of the class and she told us all about lymphedema and how it affects this population, you know, the pain that they go through, what the treatment is like, and how there's just not enough therapists that are trained in this work. So she started talking about MLD and how it's this light, gentle work. And I was just like, sign me up. It really wove in well with what I was learning in the oncology class and knowing that I wanted to work with this kind of population already. So I was kind of hooked from the get-go.
I love it. And then how did you transition? So my guess is you already had a practice, you were up and running doing the work. How did you transition to specializing in MLD and seeking out clients that needed this specific modality?
Actually, I started out specializing in this from the beginning.
Gotcha.
Because right after taking Tracy's oncology course, then I took the full CLT, 135 hours of lymph. I mean, I was in it, right? Like it was 10 9-hour days in class and I was standing on my head in between, but I loved learning about the lymphatic system and that it was this gentle modality. When I was in massage school as a student, I just naturally felt more at home in the more superficial layers. Mm-hmm. And I had a couple instructors that are like, you're not going to find any work. Like people want like the elbow and the, you know, and I was just like, that just doesn't feel right to me. So then finding out about MLD and all that it can do and the kind of work that it is, that it's gentle, but it's really powerful. It just, you know, it just took off from there. Yeah. It was that I was just in it right from the beginning. And so that my specialty, when I did open my practice after graduating from massage school and then taking the oncology course in lymphedema, I was starting with lymphatic from the very beginning.
I love it. And in my head, I'm glad you clarified that, because in my head, I thought you were introduced to it as a CE. So that's even better that you were introduced right from the beginning so you could really have this clear path going forward. That's wonderful.
Right. I was a blank slate from the beginning. And yeah, just got into it right away.
And did you seek out oncology massage to start and oncology massage clients, or how did you sort of weave your path to work with different populations?
Yeah, I started out looking for oncology massage classes. And then after taking the CLT course, I started working with a client in a nursing home facility. So I was going there a few times a week and doing bandaging. And then from there, bringing oncology clients into the practice, lymphedema, and then eventually lipedema, and learning how MLD can help so many different populations. Folks with fibromyalgia, Lyme disease, diabetes, as diabetes can sometimes cause damage to the lymphatic system. So I think that starting out with having this oncology and lymph-based practice, I was able to learn as I went how it could help so many different people.
That's great. And that's one of the things I really want to emphasize in these lymph talks is that oftentimes, I think when people hear MLD in the modality, they associate it immediately with oncology massage, and absolutely yes, but it's so much more. It can help in so many other ways. Before we talk a little bit more about specifically how MLD can impact people coming from an oncology treatment or from a fibromyalgia background, can you take us as one step bigger than that and talk just, I don't know if we could talk about this for hours, but can you summarize in a few sentences how MLD does impact the lymph system and how working with the lymph system has an effect on the overall health of the body and client? I know that's a big question. That's a lot.
It is. I was like, sure. So we think about MLD with the lymph system as kind of, you're giving it a bit of a nudge, right? You are literally pushing the lymph along, encouraging it to move along the pathways that it's moving. But especially when you are dealing with lymphedema and rerouting fluid, you're opening up doors. So you're stimulating what I like to call, there's like workers in the department, right? So if you're working in the axilla and you're stimulating those nodes, you're thinking about waking that up, getting those nodes ready to receive more fluid, to just kind of energize them to do their work, to optimize what they're doing. And then you're stretching that skin and you are encouraging the lymph to flow more optimally. You're thinking about pulling the anchoring filaments so that those lymph collectors can pull in the fluid from the interstitial spaces and get it going where it needs to go, through the nodes back to the cardiovascular system. So yeah, it's when I say powerful, that really is, you know, even though it's light, gentle work, you have this impact on this very underrated system. And that can really make folks feel good in a number of ways. It's pain relieving, it's relaxing. Folks feel lighter or clearer, depending on what they have going on in their bodies, but especially if they have a lot of density in their tissues, they can feel lighter. They can feel that they have better range of motion. Their mobility is better in their knees and their feet, wherever they have that collection of stagnant fluid.
Yeah, I love that. And I love the word powerful. That is so important for people to hear, because often, like you said, back to your instructor in school, people tend to translate like deep work is effective work, but this is the opposite of that. This is powerful, yet on the superficial layers, lighter work. So question that I've received from learners, and I want to ask you as well, when you're working with different types of clients who are coming to you for different reasons, let's say the two examples we're kind of focusing on in our lymph talk is our oncology and fibromyalgia. Do you approach those clients with the same, like, is there an MLD flow that you use with everyone? Are you tailoring the session to each person? Can you give us sort of an overview of how MLD techniques are applied and how you make those choices?
Sure. And it very much, I know this sounds like it's sort of a blanket statement, but obviously it really does depend on what someone is presenting with. As an example, someone with fibromyalgia, even though MLD can be analgesic and relaxing, sometimes even that can be a lot for the body. So sometimes if someone knows that they can go into flare easily with fibromyalgia, they might get increased joint pain, or they'll get those tender spots, or they'll get fatigue. We might start off with a shorter session. We'll do maybe 30 minutes on the table of MLD so that their body can absorb it. We can check in with them a day later and say, how did that feel? What changes did you notice in your body? What was positive? What was negative? What was neutral? So that even though it's gentle work, that it's not something that's overtaxing their body. And similar with the oncology population, it depends on what they have going on there. Sometimes they might have some swelling in sinuses in their ankles, and that's something that we can work with that way. And then obviously if there are nodes that are removed in a certain area, that's where we're going to think about, okay, well, we don't want to be sending work to this department where there's some workers missing, right? We want to reroute and think about sending it to places where the lymphatics are intact and healthy.
Yeah. Oh, I love that. And I love too the visual you have of the workers and their different departments, because I think that makes it easy for people to understand. And side note, for those of you who are listening, Megan's also an illustrator. And if you go to her website, I'll give the URL at the end of our lymph talk. You can see some of the great illustrations she's done to really depict the lymph system. It's really helpful when you're learning this for the first time. They're great. I love it.
Thank you.
Yeah, of course.
Fun to create.
So, yeah, of course. And they're fun for us to learn that way. So I'm glad that you're able to create them. And I know there's a book you've created and you have some out there for people to enjoy. So I encourage you to go check that out. So let's really sort of start taking these concepts and making them personal. Can you share a few client stories, people you've worked with MLD that have really had a profound impact and result from the work?
Sure. It's tough to pick because
I'm sure
it does so much, right? I think about the lymphedema client who MLD is part of their decongestive program. So they might be doing MLD and they'll have compression garments or a pump or remedial exercises. But in the case of like a breast cancer patient, they might have some swelling that can happen in the lateral trunk. This is a popular place where lymph likes to collect, and a compression garment and a pump might not get that area. So that MLD can really help decongest that area so that they feel more comfortable, so they don't feel like they have, folks have said that they have like a pillow underneath their armpit and like, oh, it's just not as comfortable. So MLD has been great for things like that. Folks with lipedema who might have trouble picking up their legs because they just feel so heavy with that fluid in there, for them to be able to say, oh, I'm walking better. I feel like I can fit into my shoes better. Like I'm able to just do my daily activities better. But there's one story that comes to mind. It's a new client that came in recently, and he walked into our office, 6'5", built like a linebacker, because he was a retired professional football player. And shame on me, when he walked in, my first thought was, oh, dude, are you in the right place, right? Because we do this lighter work here. And in his intake interview, he said, no, he said, I've had all kinds of massage, I've had deep tissue, I've had sports, and that's all great. He said, but I went to a place in Colorado and I had lymphatic drainage massage for the first time. And that was a game changer. He said, he said, my body's been through a lot. I'm in chronic pain. And this work made me feel so good. It took my pain away. And so now he comes in about once a month and just melts, right? He sleeps better afterward. He's like, this is my vacation from my pain. So again, I keep using the word powerful, but it's such a testament to this work. And I think sometimes we can think that MLD is just for folks that are medically frail or ill or can't receive something that's heavier, but less can be more for so many people. So I am a big proponent of this work. And yeah, I love that this client comes in and just adores it.
I love it. And isn't that interesting? He was just introduced. He was away somewhere, went in for a session. He was introduced. So you never know how someone's going to come across and be introduced to this technique. And I encourage people who are watching who haven't received an MLD session, find a local practitioner and go receive a session, wouldn't you say, and see what it's like?
Absolutely. It's, yeah, if you know, like when you're at it, you're just like, yeah. It's awesome. It's making me, I'm like, oh, I haven't had MLD in a while. They're gonna get a the more I'm talking about, I'm like, that's right. It feels so good to receive too.
Exactly.
Do that.
Exactly. So Megan, last thoughts. What if we've got someone who's listening who doesn't know much about MLD or nothing yet? What would you encourage them to do? If this is sparking some interest and excitement, what next steps would you encourage them to take?
I would encourage them to, as we just said, to receive the work so you can see what it feels like. I would seek out some lymphatic practitioners in your area and talk to them about the work, because most of the folks that are trained in it are often passionate about it as well, because they're seeing what the results are. Yeah. And then if it's something that you want to pursue further, there are some great schools out there. There's a lot of options as to how you can get this training. But yeah, we need more of you out here. We need more folks out here doing this work, because there is such a need. There really is.
I love it. Thank you so much for taking your time today to talk to us more about lymph system, MLD, and how the two can combine to really help enhance clients' wellness, and how powerful this, what you would say, gentle modality can be. I really appreciate you. Those of you watching, if you want to know more about Megan and what she does and what she has to offer, please visit her website at onerivermassage.com and learn more about the free online ABMP CE Summit on Lymph at abmp.com/summit. Thank you so much for being with us, Megan. We appreciate you.
Thank you, Kristen.